Hi, I'm Ben Deitzen. I'm a family nurse practitioner with primary care at Tamarack Health in Ashland, Wisconsin. I grew up in Kalamazoo, Michigan, where Meg and I met, and we're kind of outside of Kalamazoo in a small rural town, about a half hour outside, so kind of grew up driving in half hour to Kalamazoo, so I'm used to living in a rural area. I was a travel nurse for 6 or 7 years in the ER. I worked for a little while on the floor and then switched into the ER and then did a couple years at the local ER and then travel nurse for several years, kind of throughout lower Michigan, and went to Alaska and Oregon as well. I'm really interested in kind of that connection between increasing access to care and trying to help keep people out of the ER and urgent care as much as possible. So really my goal is to try to have openings in my schedule and try to fit people in as much as possible, and also help kind of direct them to if they need to get in to see a specialist or need to get in to see a physician as much as possible, and have that follow-up from the urgent care ER as well. I read a lot. I'm usually reading 2 or 3 books at a time and then listening to a book. I just like being outside a lot, whether it's just sitting down by the water or going paddleboarding or walking out on the lake when it's frozen. We just like to talk and spend time together and go for walks. We like a lot of the same things and both had a lot of the same goals. We both were in medicine and wanted to kind of live in a more rural area and be part of a community and have a family together in a community that we could be part of and watch it grow. And living on the lake and having the access to the lake is really important to both of us. I think it's healing to be by the water. The dogs love the water. We take them down almost every day, we call it downstairs, to the lake, and let them go swimming and chase each other. And our younger dog loves to chase us when we go paddleboarding. She'll come swimming out. She doesn't like to let us go by ourselves. I am a huge fan of Tamarack Health, and I think that the mission to really provide local care and quality local care is really important. I think the idea of providing the services that are needed and really focusing on what services are needed by the community and making those available locally is really important. And it's really nice to be able to refer to specialists who are very respected and who are close and able to get patients in, especially if there's something important or urgent that we need to get them seen for.